pleasant day to all of you. Today, we will be discussing our research topic about promoting water sanitation and hygiene to Indigenous people of Bangkal, Abucay, Bataan. Together with my cohorts, Shara Laksamana, Abigail Talurin, Raister Vasquez, Eliza Mercado, and yours truly, Sean Martin Villasor. Presentation outline. Introduction. Review of related studies. Methodology. Result and discussion. Conclusion.
Bangkal, Abucay, Bataan with a total area of 79.72 square kilometer consists of 59.375% are ITAs and 40.625% are non-ITAs. Based on the census that we gathered in 2015, there are 152 households in Bangkal by 2020, and it rises to 152 households. Statement of the problem. It impacts health by causing acute infectious disease and malnutrition in children. A limited water supply leads to the poor practice of hygiene. Objectives. The potable water has enough supply among the indigenous people of Bangkal. Some families are connected to the main water supply line, but frequently experience no water supply for 1 to 2 days. Due to limited access, a minority does not have proper hygiene and sanitation. Number of families do not own comfort rooms in their houses. For this reason, often defecation is still present in the area. When it comes to the solid and liquid waste, there is some mismanagement since segregation is missing. Thereby, wash program should be implemented in Barangay Bangkal. Significance of the study to the public, to the faculty, to the parents, to the students, and to the researchers.
Review of related studies. Other studies are to give sanitation service of basic water, understanding of health risk and the importance of sanitation service, to give the WASH program to the people in rural areas, especially women, to prove the effectiveness of using soap and water, and to access safely managed drinking water and sanitation services and basic hygiene. Meanwhile, our study is to give importance to the true value and objective of WASH program, although the relative numbers show the positive implication regarding community practice of Bangkal, insufficient knowledge, awareness, and lack of available sanitation facilities and lack of water supplies are the factors that are needed to be addressed. Thus, the community should strengthen the program and information dissemination regarding waste management, sanitation, and hygiene to resolve the problems being raised. Thereby, implementation of the WASH program is needed in Barangay Bangkal, Abucay, Bataan. This will help to improve adequate sanitation, improve hygiene, and to control the measure of health risk as a reduction of poverty in Bangkal.
Statistically reflected, the current economic status of the indigenous people in Bangkal has less income. A majority of them cannot afford to have private latrines and a sustainable water supply. The barangay officials should be cooperating with the municipality of Abucay or to the provincial LGUs and propose a project that can supply the needs of sustainable water and public toilets that can access by the community. It would make the WASH program possible. It is the primary need to perform the program. The community was also not aware of water contamination testing. Despite its challenges regarding potable water, it's been recently improved. As we can see in the screen, Project Dalo installed a drinking water station with water purification and filtration system, with approximately a capacity of 2,000 liters per day. When it comes to the ability to wash hands with soap and water to prevent transmission of disease causing germs, very few households were found to possess soap regularly. The local official of Bangkal can work together with the school teachers to have regular teaching of students and parents the proper way of performing the water sanitation and hygiene, to insist in the knowledge of the youth and children of Bangkal community the importance of WASH program. Furthermore, there was also mismanagement of solid and liquid waste, and the reason of waste management is absent. Officials must also make policies regarding the restriction of open defecation and proper waste disposal to ensure a hygienic environment. Additionally, while performing physical interview, asking if they heard or some of the family members is experiencing any related to waterborne disease, very few of them said yes, and not sure if it is from the food they ate or from the water they drink.
Methodology. Conceptual framework. First, understand the problem. Second, make possible solution. Third, deliver solution. And lastly, monitor and move forward. On December 13th, 2020, the primary information was collected. A purposive method was conducted in the community. It was per household interview. One of the members will answer the provided questionnaire. All the questions were translated from English into Filipino for the language preferred by the participants and perform the survey orally. The approaches are a variety of qualitative data used to capture the different understandings and lived experiences of water safety in Bangkal. Using a sample community with a specific knowledge for qualitative and quantitative methods relating to the research questions were asked for interview and inclusion in the data collection process. This study is a concurrent blended strategies approach includes a quantitative survey and subjective interviews and participatory transect walk. The quantitative and subjective information were concurrently collected and analyzed.
For the conclusion, contamination testing was not fully recognized by the community. Moreover, there is an impaired sanitation depot in which the majority of disposal bins were not covered. Also, waste segregation is absent despite the availability of soap and water. As a solution, proper disposal of solid and liquid waste is necessary. Also, execution of waste segregation should be done. Inaccessibility of usable toilets is a significant indicator of defecation malpractice. This will most likely influence the people within the vicinity to do such dereliction as it became a habit, and that the convenience of hygiene practice is out of reach. Building latrines is the solution. Limited water supply. Some families in Bangkal are connected to the main water supply line, but often experience no water supply in 1 to 2 days. This leads to a lack of personal hygiene, which is taking a bath daily nor washing hands at least 3 times a day. Even though there are hand washing and sanitation area in the health facility, it is way better to own each household sufficient water supply for sanitation and hygiene purposes. People in Bangkal were found to be aware of the health facilities in their community. However, the knowledge of the existence of community-acquired waterborne diseases was inconsistent, since the households were associated with each other, lacking consciousness and the variability in the perception of the existence of such diseases will pose a detrimental effect on the community. And so, the proposed WASH program could address the problems in Bangkal through waste management associated with the malpractice of proper disposal of solid and liquid waste, such as the execution of waste segregation, discouraging for open defecation. People need to understand, firstly, the reason why toilets are important in terms of the health benefits, and secondly, knowledge in the transmission of disease and other risks related to open defecation, and the municipality of Abucay should pay attention to Bangkal. Propose a project that needs of suitable water and public toilets that can be accessed by the community. People in Bangkal should practice well and be vigilant with the community project, which will benefit their household social well-being and health status. It has appropriate sanitation, improve hygiene, and control the measure of a health risk to reduce poverty in Bangkal.
To express our views in a clearer manner, we created this visual representation. We believe that it takes all this to improve water sanitation and hygiene in Bangkal, Abucay, Bataan. Thank you.